Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about cataracts. Alright, now that we have our threads on, we can go over exactly what a cataract is. And to do that, let's look at some anatomy. Now, to quickly get over the structural parts of the eye, the front part is the cornea. That's where we have our contact lenses in. That's where we have our LASIK surgery right on the cornea. Behind the cornea will be the iris, the colored part of the eye. Behind the iris, we have the crystalline lens which helps light focus to the retina. In the back of the eye, here which we fix up the signal of the light and sends back to the brain to let you see. They're the big things that we're focusing today is the crystalline lens inside the eyes. This is where a lot of magic happens. When we were young, this lens remained clear, thin, and flexible. It allows us to focus on the objects and the distance as well as up close. But as we get older, this lens becomes thick, rigid, and it makes it difficult for us to focus on things up close, causing us anything like to be bifocus. As we continue to age, this lens actually begins to change color, fogged over to opaque, and it's hard to see through, and that's what we call cataract. There are actually many different types of cataract. It's nuclear cataract, corticoid cataract, posterior or capsule cataracts, Christmas tree cataracts, diabetic cataracts, just to name a few. Now, there are different causes for cataracts. We form them into general cataracts. People can develop them. Medications used, or perhaps there was a trauma, or eye surgeries that can cause cataract to develop. In some conditions like diabetes, which put people in much higher risk for developing a cataract. Almost up to 25% could put higher risk for somebody who doesn't have diabetes. Now, the honest truth is that when you were born with the crystalline lens and you get past around the age of 50, everybody develops some form of age-related cataract. It's part of the aging process, kind of like having a gray hair. If you leave a metal outside, it will eventually rust. And if you bite an apple and leave it in the counter, it begins to turn yellow and brown. That's called oxidation. And that same process is what causes age-related cataract. As we go older and approach around the 50s, the lens inside the eye starts to go that oxidation process. And it begins to turn yellow and eventually brown. And as the start of the lens turns color, it actually becomes opaque and harder to see through. Now, there are different types of age-related cataracts. The cataracts can form in the nucleus. At the very center of the lens, it can form the cortex, the other edges of the lens. And it can even form on the capsule, kind of coating of the M&M. You can think of it that way on the outside shell of the lens. Now, the nuclear type of cataract is usually the one that turns yellow and brown color, and that's the very center of the lens. There's the corticoid cataract, which starts at the cortex and kind of looks like the little spiky edges coming in from the sides. And if those spikes hit the very center of the lens, you can see much after that. And then the capsule cataract, which is a pretty rare, only affects about 10% of the population. And that caused by the cell that swells at the back of the surface of the lens, and that causes a rapid changes in loss of vision. Then usually the developing process of cataract is very slow change. Then usually the developing process of cataract is a very slow change. It's so slow that a lot of times you don't even realize that it's happening. A lot of time people just come in to have its routine exam and suddenly the doctor tells them that you can't see 20/20 anymore, even in the eyeglasses because you have a cataract. It is pretty easy to imagine a vision changing with the cataracts, kind of looking through a clear window that gradually becomes kind of fogged glass window. Not only your vision becomes blurry and out of focus, but actually the light becomes scatters and causes more problems with the bright lights like headlights. And that's one of the reasons why we have trouble driving at nighttime as we get older, because the cataracts has a light like scatters giving up as bright light glare, and it's hard to really pick up small details. Another way the cataract affects the visions with the color, because the cataract turns yellow and eventually a brown color, and that filters out a blue light. And so many people have trouble picking up the differences between blues, blacks, and other dark hues of the spectrum. Sometimes I'll be able to tell if the patient has a cataract just by walking into the office because they have one blue sock and one black sock on. So did you know that eye diseases such as cataracts has actually influenced famous artists brought all of history? Paintings by Picasso and more famous Mona Lisa's blue period, requiring them to use darker and darker shades of blue in their paintings. My favorite way to evaluate the patients for cataracts is utilizing called Schmidt lump. Allows me to a high definition view of the cataract inside the eye. I can actually crank the magnifications to 25 times, and that gives me a really high definition view of which part of the lens is changing and responsible for that person's vision. Now, when somebody develops cataracts in the very early stages, it may not affect your vision very much at all. And that person may continue to do well with his glasses on and contact lenses, or maybe consider a surgical correction. However, as cataracts becomes more dense, it eventually affects the visions to the point where glasses and contact lenses and nothing else is going to help them but be better except for the cataract surgery. Now, we don't really have much time in this video to cover everything about cataract surgery. But in short, it's an operation where they remove the cataract from inside the eye by breaking it up into many pieces. They remove it and then they put plastic lens in its place that allows you to see more clearly again. And the procedure usually takes about 15 to 20 minutes. Very successful and one of the doctor's favorites to recommend patients for. And what's really cool is that the implant that they put inside the eye can accommodate your prescriptions and get you to see without even needing a glasses, all except for maybe just reading glasses. To a lot of people, after knowing they have the cataracts, they want to know what they can do to slow down to prevent the development of cataracts. And there are actually a couple of things that you can do. The number one way that you can do is to reduce the number of cataracts is to reduce the development of oxidation. They can do that by eating very healthy, lots of fruits, vegetables. Those antioxidants and minerals that you get from those foods are going to help you slow down the whole oxidation process. In particular, vitamin C is an antioxidant in a very high concentrations with the eye, and it's believed to be help slowly downing the cataracts to some degree. Second pro tip to slow down the development of cataract is to wear sunglasses when you're outside. Sunglasses actually filter out the harmful UV radiations light that we get from the sun. And they actually done studies that people like fishermen spend a lot of time in the water, they're more likely to develop cataracts at a faster rate. Because the UV light comes down, hits the water, bounces up, and hits them twice, again causing the cataract development faster. Adding things you can do to help reduce the development of cataract is to wear a wide-brimmed hat. Protect your eyes from the UV light radiations. Tip number 3 is ultimately you go in and see your doctors. Get the evaluations, figure out if you have the cataracts or if you're at risk of developing or worsening cataracts, and listen to what they have to say and recommendations for you and your prescription.